Biz, 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 biz. I'm Bella Shaw for Biz. It was a very poignant moment when Joan Green couldn't communicate with her own father. But it was because of that moment that she came up with a healthcare communications app that could greatly improve the lives of those who are ill, sick, or suffering, and save lives. Joan Green, so good to see you.
Nice to see you. Thank you, Bella.
Let's talk about that poignant moment with your father, who, by the way, was a genius and spoke half a dozen languages.
Yes, my father was a nuclear physicist who spoke 8 languages. He worked on the Manhattan Project and got the highest honor that America gives to its scientists. He got pulmonary fibrosis. It was very frustrating for him since he was intubated and medically paralyzed. He could not speak and he could not move except to nod his head. So when I got to the hospital and I looked at him and he was looking at me imploringly, and I said, "Dad, do you want to tell me something?" And he nodded his head. So I asked the ICU nurse to please go get me a communication board. So they had to go to an entirely different floor of the hospital to get a communication board from the speech therapist, as if the only people that needed to speak in the hospital were going to speech therapy. They brought me a black and white piece of paper that had been Xeroxed a million times. It had 8 pictures on the front: turn me, eat, doctor, medicine, and on the back was the alphabet. I said, "Is it this, Dad?" And he'd said, "No." Is it this? "No, no." So I said, "Okay, we're gonna have to do it this way, Dad." And I turned it over and we started to go through the alphabet. And I finally said, "Dad, are you trying to say I love you?" And he started to cry, and 3 days later he died. I went back to his house that night thinking that no one should have to work so hard to communicate, especially something like "I love you," when they are so sick.
But something good came out of your father not being able to communicate.
And so I started making a list of the things that people might want to need or ask for if they could. And throughout of that came our healthcare communication board, which is a tablet that is in hospitals now, that patients can use to communicate their wants and needs. But it was limited because it's only got a page.
So tell us about your app. There's hundreds of things that it communicates.
There's 7 different pages that are on the app. The first page is the urgent page, which is like the board, which has the most urgent needs with your pain scale and where things hurt and how much they hurt. There's things like something is numb. Let them know that you're not getting any circulation, and there's no way that anybody would know to even think about asking you that. There's bodies parts that you can touch where let them know where there are things that are going on with you or they might not even think about. Oftentimes you'll be giving medication and they think, "Well, I've given you the medication for your stomach surgery," but they don't realize that maybe you're getting a horrible headache from that medication. Your head is killing you, so you can show on the body, "This is my stomach pain and it is on the pain scale of 5, but this is my head and it's on the pain scale of 9. And without that, nobody would even know.
And simple things like their feet are cold, just being comfortable.
In the hospital, your feet are always cold, so you can ask for socks.
Socks, please.
The lights being turned up.
Lights
Or
on.
them opening the blinds because you want to see some real sunshine. This app is going to have many, many languages on it, so people from all over the world can communicate with each other.
Voltéame. Doctor.
Another section you cover, Joan, is emotions. And emotions run high when you're in a strange place and in a hospital setting, don't they?
That's another whole aspect of the healthcare industry that we sort of forget about sometimes, is that there's a human being behind there. And so when they can understand that this is more about this individual, then they're going to treat them differently. And then there's other things like, I'm afraid, I'm confused.
I'm scared.
I'm scared, I'm frustrated. The feelings that you may have when you're in a situation where you don't have the control over your life, like you often feel like in the hospital.
Type text.
I miss you.
One of my favorite icons you have is I forgive you.
I forgive you.
I talk to doctors, I talk to nurses, I talk to children's hospitals, I talk to speech therapists, I talk to ICU people, and what kinds of things might come up. And one of the hospice nurses said one of those things was, "I forgive you, do you forgive me?"
Do you forgive me?
Another one she said was, I hope I made a difference.
What is your hope, that every hospital has this, that every nurse will be able to carry around their pad and have this app?
My hope is that anybody who has people that in their lives that they cannot communicate with for whatever reason will use it. It is for hospitals, it is for assisted living, it is for home health care workers, it is for family members.
And your artwork is so great. You work with the same artist that helped you in the publication business.
Right. This all started actually, I was a special education teacher for 20 years, and I used a method to work with kids with autism by using pictures to communicate.
And that's why there's special apps for children, for the pediatric hospitals.
That's right. The pictures are all drawn by my artist, Linda Comerford. She hand draws every picture that I've ever published for anything.
Joan Green, thank you for joining us in the Biz Spotlight.
Thank you so much for having me.